Good afternoon and welcome to our weekly media briefing and public health update with Montgomery County Executive Mark Elridge. I'm Lorna Vigilla, Hispanic Public Information Officer, and joining us today is Dr. James Bridgers, who is the Director of the Department of Health and Human Services, Mr. Sean O'Donnell, Assistant Chief of Public Health Services, Dr. Earl Stoddard, Assistant Chief Administrative Officer, and our guest today is Christine Hong, who is the Chief for Services to End and Prevent Homelessness. Thank you everyone for joining us. Mr. County Executive, good afternoon. Let's get started.
Thank you all for being here again today. So now we've reached the 15th day of the federal government shutdown. And what's happening in Washington defies common sense, and that shouldn't be a surprise to anybody. The Trump administration and congressional Republicans refusing to sit down and negotiate. That refusal has real consequences for families and communities across the country, including right here in Montgomery County. Federal workers at Health and Human Services and the National Institutes of Health are being told they're out of a job in the middle of a shutdown. That action is both illegal and irrational. These are public servants who protect our health, monitor disease outbreaks, and conducts research to save lives. Firing them weakens our national security and undermines our public health data. Over the past weekend, the Center for Disease Control and Prevention sent out roughly 1,300 termination notices, only to have to rehire about half of those employees after they realized what they'd done. That kind of whiplash reflects deep managerial failure and leaves the nation less prepared for the next public health emergency. Even some members of Congress are starting to see the harm. Marjorie Taylor Greene, of all people, seems to be the only congressional Republican realizing that the rising Affordable Care Act premiums will hit rural and lower income areas just as much as they'll hurt places like Montgomery County. This action is not going to have partisan impacts. It's going to be bipartisan. It's going to hurt people regardless of what party they're in, and it's not something that we should be allowing to happen. As of last Friday, every federal worker outside of the military missed a paycheck. We encourage those impacted to use our county's network of food pantries and community resources, which are ready to help anyone who is in need. I also want to thank our residents who continue to donate food, money, and their time to help their neighbors get through this. Montgomery County's strength has come always from our community that cares enough to take care of each other. Last week, we opened the Mobilized Montgomery Federal Workforce Career Center, the first of its kind in the country, to help displaced federal employees find new opportunities and to navigate this uncertainty. Since last week's press event, we had 114 federal workers sign up for services. We want to continue promoting this and hope that you will as well inform your audiences by directing folks to our worksourcemontgomery.com website. Last week, the Trump administration engaged in mass firing of all data workers at HHS, further crippling that agency. But Trump understands perfectly well that killing the collection of data makes it harder to explain what problems exist and what is needed to address them. It is consistent with his attacks on research at NIH, FDA, the Weather Service, as well as climate change offices in the federal government. It's the president's way of cutting Americans off from the truth, enabling him to lie at will while making it impossible to generate data that would undermine his arguments. He's deliberately blinding government agencies, and that extends to local governments that rely on some of this data so that they can't inform the public and policymakers about the repercussions of their actions, as well as the reasons why government programs to protect the well-being of our people are necessary. I guess the president's theory is that if you can't see it, then the problem doesn't exist. So he believes that if he makes sure none of us see any of the problems, then we'll believe, despite what we see happening around us, we'll believe that the problem actually doesn't exist either. This is no way to govern. While the shutdown continues to dominate the headlines, I want to focus on something that's going on underreported, and that's the disappointing developments out of the Department of Housing and Urban Development, or HUD, and these are harming county residents. Since January, working at HUD on behalf of single mothers, the disabled, and minority tenants denied housing has been stopped, and many lawyers within the department working on fair housing complaints were reassigned or fired. A whistleblower's report earlier this year focused on the Office of Fair Housing, which shed light on how staff within the office went from 31 to 11, and staff attorneys have been slashed from 22 to 6. The federal government has no intention of enforcing fair housing laws, and that's a real serious problem. Over the last 5 years, HUD has collected between $4 million and $8 million in legal settlements from Americans who accused housing providers of discrimination. From January to July 2025, less than $200,000 was collected. And as you can see from the New York Times headline, Trump appointees rollback enforcement of fair housing laws. This is a real danger to people's ability to find housing, and it's a problem that we should not be dealing with now. Trump appointees running HUD have ignored historic legal findings that helped end redlining practices and have dismissed landmark housing discrimination cases as artificial, arbitrary, and unnecessary. As they wrote in one of their memos reported on by the New York Times, the cases are not a priority of this administration. That is likely to create huge problems within Montgomery County moving forward. In addition, Politico reports that HUD is considering cutting critical 70% of continuum of care funding for permanent housing, which keeps people with disabilities stably housed. We work every day to ensure that all people, including the most vulnerable, have a safe, stable, and affordable place to call home, which is why the threat of losing federal housing funds from HUD is so concerning. Hundreds of the most vulnerable people in Montgomery County would be forced back into homelessness if these funds are cut. And I want to point out that they're using the same kind of, what's the right word for it? The same deception when it comes to disabled people as they do with minority groups and other groups in our country. They're basically asserting that the programs that help the disabled give them an unfair advantage. The idea that we're giving disabled people an unfair advantage by helping them is ludicrous. It also gets to the point of how heartless and insensitive this administration is. I've written a letter to our congressional delegation urging them to ensure HUD funding is not cut because it keeps people who are vulnerable from becoming homeless and it strengthens our community. The funding allows us to partner with nonprofits to support and house residents with special needs who've experienced homelessness. Without financial support through HUD, these essential services would suddenly stop for hundreds of people with disabilities in our county. HUD's Continuum of Care grants support numerous programs administered by the Services to End and Prevent Homelessness. We call it SEF here. They are part of HHS's budget, and both partners and landlords rely on that money as well. Our county has done extraordinary work in planning and initiating a strategic response to homelessness, but without HUD money, it's just an aspiration. It's not going to be an action plan. People experiencing homelessness in our community deserve better from the federal government. The president's threatening to condition grants on passing legislation to outlaw camping outdoors or sleeping in the streets. We would love to be able to provide decent shelter space to people who need it. Cutting off federal funding makes it even more difficult to address homelessness. It actually makes it even harder to get people off the street. So if that's the president's goal, what he's doing is actually making it more difficult to solve the problem rather than solving the problem a little bit easier. We all deserve better. Millions of Americans nationwide already face barriers to housing, so cementing these changes at the top will embolden bad actors. Enforcement of the Fair Housing Act is going extinct, and that breeds discrimination and allows intimidation to be used against families in vulnerable positions. It is yet another battle we must fight to keep this a free and fair nation. I have Christine Hong today on our call. She heads up the county services to end and prevent homelessness program in the Department of Health and Human Services. I'd like to thank her for her work, especially since she's been the chief there, and invite her to share a few words about the potential impact of losing HUD funding. So Christine, it's all yours.
Thank you so much, Mr. County Executive. I am very concerned about the possibility of federal cuts to our HUD funding. That funding supports 757 people who are currently in housing who experienced homelessness. And without that, if we receive a huge cut, starting in January, those people will be forced out of their housing, and we may see an increase in unsheltered homelessness. This impacts also our landlords because they rely on that funding for revenue in terms of rent. It would also impact our businesses. A large increase in unsheltered homelessness impacts our entire community. People who do not have services or who do not have housing available to them end up relying much more on our hospital system, which is more costly than being housed and being connected to medical services. And also, it would put a great strain on our public safety system. So, on so many levels, this funding is essential to people who have disabilities. There are families housed as well in this HUD-funded housing. And so, children would be looking at a return to homelessness. It's simply cruel, and it would not make Montgomery County stronger. It would make us more vulnerable, and it would be catastrophic. So I thank you, Mr. County Executive, for writing the letters to our congressional delegation. That was so needed. And I want to thank also our county and all those who participate in fair housing enforcement and investigations. When fair housing protections are not enforced, it also leads to an increase in homelessness. Our county is wonderfully diverse racially and ethnically, and we know that in my 20 years working in homeless services in our county, that housing discrimination still does occur. And so the Office of Human Rights, the Department of Housing and Community Affairs, Services to End and Prevent Homelessness, we must continually work to ensure that our fair housing laws are enforced. And when there is suspected discrimination, that those cases are investigated. So I can't stress more how important it is that that work continues, and how devastating it would be if, as these cuts to HUD, if they're approved, how devastating it would be to our county.
Thank you, Ms. Hong. Members of the media, we will open it for questions from you now for Ms. Hong or the county executive regarding HUD funding. Please raise your hands. No questions regarding housing? I see. Sarah Kim, WAMU. Go ahead, Sarah.
Hi, thank you for taking my question. This is kind of a question related to homelessness generally. Christine Hong, I reached out to you a few weeks ago about the impact of federal encampment clearings like in the district. And I know there were some concerns that that would place a burden on county resources. And I think the last time we checked in, you said there wasn't a significant increase. But I was just wondering if there has been any change since then, and if there has been any kind of notable increase or additional burden you're seeing on Montgomery County.
Thank you for that question, Sarah. So based on data that we're tracking, which requires that our partners ask people where they're coming from, where was their last residence, and where did they last stay. Based on that data, we did not see a significant increase. However, we did notice people were less comfortable sharing that information, and understandably so, because people were being asked to show their IDs in the district who were sleeping outside. And so as far as inquiries, people calling Services to End and Prevent Homelessness and the Crisis Center, we have been receiving many more calls of folks who are concerned about unsheltered homelessness. We cannot report that is directly connected to the encampment clearings because there are so many ways in which people are being impacted by federal cuts and the workforce reductions. So what we can say is we are seeing more people unsheltered in Montgomery County. So all of these federal policy changes, proposed budget cuts, are having an impact, and we expect that it will worsen over time.
Got it. Thank you.
Thank you, Sarah. Suzanne Pollack, Montgomery Community Media. Good afternoon, Suzanne. Go ahead.
Can you tell me how much the county gets from HUD for this, for homelessness or for housing?
Yes, we receive about $12 million annually in continuum of care grant funds. That we apply the county as a collaborative applicant with our community partners. And so those partners would lose the funding and would not be able to continue to serve the households we were talking about, most of whom have disabilities. So that funding goes to support mostly permanent supportive housing, which requires a documented disability to be eligible for that type of housing. Some of it supports rapid rehousing, which is for less vulnerable households, including families. And as I said, 274 children are housed in this federally funded housing and would be impacted. These grants, our current grants, will start to expire January of 2026. So if that funding is cut by 70%, then we expect to see a large number of people forced back into homelessness starting in January. It's that critical.
Thank you.
Thank you, Suzanne. Members of the media, any additional questions regarding HUD funding, housing, homelessness in Montgomery County? No more questions? Christine, thanks for joining us this afternoon. You can remain on the call, or you can depart if you have to. Minister, County Executive, other topics?
Just want to close out on this last bit about fair housing. I want to point out that in 1973, Donald Trump and his slumlord father were sued by the Department of Justice for racial discrimination in violation of the Fair Housing Act. So the president has close personal experience with the Fair Housing Act, and the suit was based on evidence that was collected by civil rights testers in New York. And essentially, Black people were told there were no units available to rent in Trump-owned buildings, while white people were offered those same units. Of course, Trump countersued. Does this sound like a familiar pattern? And they wound up settling, which is unfortunately the case. They don't admit guilt, but they made corrections to their practices. But they did so without admitting guilt. But it gets to the point of, he follows a familiar pattern, and that he himself was a slumlord who was actually sued over, violations of the fair housing law. And it gives you an idea of where his policies are coming from. He doesn't believe in fair housing personally, and he's using his opportunity now to change it as a national policy. Again, not a very good thing. In more local news, I want to acknowledge this week's news from MCPS regarding their capital improvement needs. Dr. Taylor requested $2.7 billion in their capital request for the next 6 years, $949 million more than the last approved CIP. That's 54% larger than the last approved CIP, and it translates to almost $160 million a year over 6 years. This totality of this problem is going to require more than a decade of increases to the CIP budget for them to catch up. This number is only for the 6-year CIP. It's not the total amount of the backlog. It speaks to years of neglect and how the school system laid out their needs, complicated by the lack of funding of capital projects at the county level that would have kept them from falling even farther behind. Not requesting money when it was needed was not a good policy. And while this number is a large number, I'm glad that we're starting to actually get real numbers out of the school system, numbers that we can, hopefully deal with eventually. I have not yet figured out how to digest this large of an increase, but we're obviously looking at this. If we don't deal with it, it's just going to lead to further deterioration of schools, and we can't afford to let that happen. So how we manage this is, one of our prime concerns as we're trying to put this budget together, as well as look ahead. He made a point to us in a meeting of the value of coming up with a long-range plan, either somewhere in the 10 to a 20-year plan about how we bring our schools up to where they need to be, in recognition that we're not going to be able to do all this at once. But we do need a plan, and if we adopt a plan, we're going to need to stick to it. Otherwise, we run the risk of having schools, further deteriorate, which does not serve our children very well and doesn't serve the families in Montgomery County who expect better. As a teacher for 17 years, I'm well aware of the importance of updating our schools and the passion that parents and teachers have in making those repairs as quickly as possible. One of the biggest roadblocks to accomplishing that goal is our ability to borrow money. The county council controls our borrowing caps, which remain far too low. As you can see from this chart, we're spending less money on school improvements and new buildings than we did over a decade ago. That doesn't account for inflation or the fact that budgeted projects cost more when we actually get around to building them than when they're actually placed in the budget. So if you look at this chart, you go all the way back, I think, to 2009, you see we were spending somewhere around $300 million. If you just adjusted that, and that's what the blue line does, you just adjusted that for inflation, we would be spending over $500 million today in order to build what we were building back in 2009. Instead, we're spending $280 million. The council has approved tentatively an increase up to $300 million for the next year. We asked for 340. Our proposal would have added a total of 240 million over 6 years. It obviously doesn't solve the problem, but it begins to take a bite out of it. And this is the struggle we have. If we've been totally unrealistic about how we budget for capital projects, and it means fewer projects get done, more projects get delayed, and everybody suffers for this. So this includes and handicaps our ability to build transportation projects as well. So I've been trying to draw attention to this for a number of years. I'm going to continue to draw attention to this. We need to be willing to fund capital projects the way they need to be funded. Not funding them doesn't make them go away. And in fact, what it does is it makes them get worse. And we simply can't afford to keep doing this. This is a problem we're all going to have to work on together. And I look forward to discussing these issues with council members, school leaders, and the public to find the best solution. But this requires a solution. It does not require more kicking the can down the road. I joined the Montgomery County Council this week in recognizing October as Fire Prevention Month. Preventing fires from starting is the best way to keep our community safe and avoid property damage. And our Montgomery County Fire and Rescue Service has been working to protect our over 1 million residents. And under the leadership of our chief, Corey Smedley, it's committed to encouraging a prevention first approach. Educating the public and encouraging preventive actions are two keys to that approach. This year's focus is on lithium batteries. Great for long life and the ability to recharge. But if they're not handled properly, they're a serious fire risk. Lithium battery fires are much hotter and much more difficult to put out. They can result from a malfunction in the battery that it can occur suddenly with no warning, and batteries can catch fire very easily. And when that happens, those fires are very hot, much hotter than a typical fire, and much more difficult to put out. So it's important to be aware of this. We're going to be doing education on this all month long to make sure we can inform residents. You can keep your lithium batteries, just make sure that they're not overheating, that they continue to be working when they're plugged in. If they're not working when they're plugged in, that's not a good thing. And if they feel unusually warm to you, that's also not a good thing. So we want you to be careful because we don't want more of these fires. And we do want you to recognize these fires are not even a typical fire. They're worse than a typical fire. This month, we're asking every family to ensure they have current, up-to-date, and working smoke alarms. By providing an early warning of a growing fire, smoke alarms greatly increase the chance of surviving a fire. If a smoke alarm is over 10 years old, replace it. That's not just advice, that's the law. Family escape plans should also be made and practiced. MCFRS provides complimentary home safety visits for residents who need help in developing an escape plan. Residents can call 311 to schedule an appointment or visit MCFRS online at mcfrs.com/mcsafe. October is Breast Cancer Awareness Month, and that's fueling our second annual Pink in the Park event at Wheaton Regional Park on Saturday, October 18th. Education is critical to identifying cancer early and setting up the best chance for survival. It's important to know how to screen and monitor for breast cancer, which can be done through clinical breast examinations by a healthcare provider, annual mammograms, and self-examination. Every year, breast cancer accounts for about 30% of all new cancer cases in the United States. Data continues to show a significant disparity. African American women in our county face a 40% higher mortality rate from breast cancer and frequently receive the diagnosis at later stages of development. That's why the county's launched programs like the African American Health Program, and it works to eliminate health disparities through key efforts, including cancer prevention education and outreach, as well as providing free screenings and referrals. I urge everyone to show their solidarity with Black women and everyone who's impacted by this disease. You can do that by joining us for the Park Goes Pink on Saturday, this Saturday from 10 a.m. to 2 p.m. And let's continue to advocate for equitable care and improve the health outcomes for every resident. Wear pink and please participate. October is also Domestic Violence Awareness Month, and on Thursday, everyone is asked to wear purple to support the cause. The county continues to operate the Crisis Center hotline, which is available 24/7 for victims or to report abuse. That number is 240-777-4000. We're committed to helping those in need. Our Family Justice Center near the courthouse in Rockville is free to use, and information is provided in any language. Services include counseling, legal advice, career assistance, and help with basic needs, as well as it's a safe place to meet with police detectives or staff from the state's attorney's office to help anyone, including those who are seeking to file criminal charges. So before we open it up to questions, I'd like to give my staff an opportunity to provide any updates they want to share, and I'll start with my health team.
Good afternoon, Mr. County Executive. You gave the number 240-777-4000. That is our crisis helpline, and is our number that all countyans should use if they feel stress or if they want additional information. So I appreciate you sharing that number this afternoon. It is a repeated number that we often share in the community because help is within reach. So I'll stop there and turn it over to Mr. O'Donnell.
I have no health updates this week. Just a reminder that housing is health, and all of our residents need housing before they're going to focus on their health. So appreciate everything our colleagues do and the county executive and his team do to help people stay housed.
Dr. Stoddard.
Yeah, I just wanted to share that I know last week we had the very tragic fatality of an 11-year-old child who was struck by an MCPS bus. I just wanted to share that obviously the police department is prioritizing this investigation and hoping to get to a conclusion. Typically, these investigations take about 90 days to produce the full reconstruction report and things of that nature. But having spoken to Assistant Chief McBain, they obviously understand the criticality of this particular one and are prioritizing and hoping to have some at least basic information to be able to share much sooner than the 90-day period. And we'll be obviously keeping everyone apprised, particularly the family of the young victim. They'll know obviously first sort of what we know, but just wanted to share that the police is expediting that investigation to the extent that they can, while making sure that we have all of the significant facts to include. Obviously, if there are infrastructure things to consider with regard to that accident, I don't know that there will be, or sorry, that collision. I won't say accident. I know that's important to distinguish at this point. That collision, I want to make sure that we will obviously be taking a hard look at those. It is very near to a middle school, and so, but we don't have any of that information at this point, and won't until the reconstruction completes. So that's all I wanted to add.
Thank you, Dr. Stoddard, and everyone else. Members of the media, let's open it up for questions right now. Please raise your hands. Any questions regarding any topics at this time? I see Scott Peterson has his hand up. I believe he is asking a question on behalf of Kate Ryan from WTOP. Go ahead, Scott.
Thanks, Lorna. And as you said, Mark, this is from Kate Ryan at WTOP, who wanted to have your thoughts on MCPS's decline in enrollment and what that means for the school and the county at large.
Um, it's not altogether surprising. I mean, we've seen declines of enrollment historically, and it's part of it is a natural cycle. When back when I was, I think, on the city council in Tacoma Park, Blair was the high school for the area we were in and had multiple feeder schools. And the school system was talking about closing down 2 out of 3, I think, of the middle schools that fed Blair. And within a couple of years, um, the strollers that were beginning to materialize in neighborhoods blossomed into children who were ready for school. And they wound up needing all the feeder schools that they had. And Blair got built to be an even larger school. So there's a cyclical nature to some of this. As people move in, they raise families, and the parents stay in the houses even after the children leave. And so the houses don't produce as many children. And so part of it's natural. Part of it is probably attributable to a declining birth rate, and part of it's attributable to a declining immigration rate. And fewer people coming here. Then I'd say part of it's going to be due to Trump's actions around deportation, where people have either already been deported or are worried about being deported and self-deporting themselves before they get swept up. So there's a number of different factors. What it means, I guess, for MCPS is, I guess on the bright side, they won't have to hire additional teachers to maintain class size. They may be able to manage with current staffing levels and even absorb some attrition depending on how much school enrollment goes down in any given year. So it's not all negative for them. It can create issues in terms of class size if student populations fall too small, and then the choices could be combining classes to make classes that are overly large, or having classes that are smaller than we would normally prefer. So they're going to have a variety of different challenges to deal with. But this, like I said, this is not unusual. It recurs every, so many years. It's not an abnormal thing to happen. There are a couple of complicating factors, like I said.
Members of the media, any additional questions? I believe, does it look like the county executive perhaps froze? Is that what happened?
It does.
Yeah. Folks on the technical end, can you confirm that we're having issues with the county executive? Scott Joe, if you can jump to his office and let him know that
Are there any additional questions?
yeah, any additional questions for the county executive at this time, or the health team? No more questions? I guess we are done for today. Thank you everyone for joining us. Have a great afternoon. Stay safe, and we'll see you next time. Thank you.